Thinking about a change or a glow up and don't know where to start? Let's talk about it. So let's be real. The world of cosmetics, aesthetics is huge. And there are so many things that are on the cutting edge or that are being purported as the biggest and best thing to ever happen to cosmetic medicine. And most people do not enter into the world of aesthetics thinking about going under the knife. So really and truly, what is a good way to start thinking about enhancing or maintaining a youthful appearance or a fresh look without jumping into the deep end? And there's so many of us on the internet, whether we be estheticians, credentialed surgeons and physicians, estheticians, board certified surgeons and physicians, or just lay people who've gone through some of these treatments before, who are out there just naming things and saying that this is great. But how do we really know what's great and what's not, right? What's a great first step? Where do we start? I'm here for you. I'm gonna let you know, okay? All right, so here I'm gonna go through for face and for body. What are great first steps, or what are possible first steps? And how do I rate them from a scale of 1 to 10? Now the rating is gonna be off the dome, off the cuff, so you can get my real and true feeling, okay? So for the face, let's start with Botox. Now, if you want more details about Botox and what it does and why it does it and everything like that, please go to my Botox video. But in the meantime, Botox, just for clarity, is about relaxing the muscle. And so in doing so in the face, it can help avoid fine lines or treat fine lines. I say fine lines because that's a really important distinction from lines that are static or that you see all the time, right? If you have a little wrinkle that pops up when you make a facial expression, that typically is a fine line. If you have one that stays, then it's static. Hopefully that makes sense, right? And so Botox is great for treating and preventing fine lines so that we don't necessarily get to the stage where we have static rhytids or lines or wrinkles. Where do people typically treat? The forehead, right? We are very dynamic individuals, expressive individuals, and we move our foreheads all the time. And so for that reason, we tend to get forehead wrinkles. Other places are typically around the eyes. We can do a little bit of a brow lift also with some Botox. What can you expect? The procedure is super quick. If you're afraid of needles, and many people are, myself included, it actually is not that bad. We typically use a very, very, very tiny needle that if you just tap on your forehead while we're doing the procedure, you probably won't even feel. And sometimes we distract you like that, where we try to effectively tap on your forehead while also injecting you. It's a little bit of a trick for us to do. But it actually can be a relatively painless, not pain-free, but painless procedure. The results are not instant. It takes usually 5 to 7 days to see any kind of result, and the results will last typically for about 3 months. And so you do need to get maintenance of your Botox. Who is it good for? It's good for anyone, again, who has dynamic rhytids or wrinkles or lines that they want to treat. So on a scale of 1 to 10, I give Botox a 10 as a great first step. I think that's what I have to say about that. It works really well. It's not super, super expensive, but not super cheap either. If you find your Botox is super cheap, that's probably because it's not true botulinum toxin. And remember, Botox is a brand name. There are other products out there that use the same compound, Xeomin, Dysport. These are equivalent to Botox. And so if Botox actually doesn't work for you, you can try these other two, one of the other two, to see which one works maybe a little bit better for you. But yes, it's a great first step. So 10 out of 10 for Botox. Next is fillers. Now I have gotten on here and talked a lot about fillers. And so here we go again, okay. Fillers are good for restoring volume, okay? They're not for wrinkles in any way, Are they for sagging? A little bit. If you have a little bit of sagging at the jowls, you may be able to lift your skin a little bit by putting a little bit more volume in the cheeks. But again, we have to be careful with this. And you have to go to the right person who believes in moderation and does not believe in the chipmunk aesthetic. Again, what's it best for? It's best for restoring volume. Remember that facial aging is not just about gravity working as hard as it does to pull everything down, but it's also about losing volume. So where you've lost volume, it's great for restoring it. It can be good for under the eyes. It can be good for the cheeks. It can even be good in the temples. When we age, we get temporal hollowing, so that also shows that we've aged. So it can be good there. It can be good here, right? It can be great for all those places. What to expect? The procedure, again, is pretty quick. It's not as long. It might be a little bit longer than Botox probably is. It is a smaller needle. It's a little bit more painful than Botox, especially if you're getting it in nerve-rich areas like your lips, for instance. The great part is that you do see a pretty instantaneous result. Remember, there is going to be swelling and some bruising after filler, so some of that extra fill that you see may not be what you see after the swelling has gone away. That being said, I do not recommend that anyone overfill to kind of compensate for that swelling, because in the end, it's much easier to return for a fill than it is to overfill and kind of try to step that back. And who's it good for? It's again good for people who have had facial volume loss. So what's my rating on filler? A 2. We have totally gone overboard with fillers. I think that filler is quite expensive. It is supposed to be temporary, but we're learning more and more that some filler just does not go away. The filler tends to be hard and clumpy at times, especially if it's not injected properly. And even when it is, it can be hard and clumpy. It can leave a blue tint under the eyes in that lower eyelid area. And so I say, and this is kind of going away from first steps, right? I think going in for filler once for a gentle filler treatment is not a bad idea, but being a repeated kind of customer of the filler or user, a purveyor of the filler, if you will, I think is probably not your best bet. And in the end, you should probably go to fat and use fat instead of filler. The fat comes from you, it stays with you, but you're just recycling it, upcycling it, reusing it, however you want to use the terms, to make it work better for you. So I give filler a 2. How about for the skin? If your concern is how your skin appears, what's an entry level for that? So to improve the canvas of the skin, you actually have a ton of options. And this is where this video is gonna be kind of just a starter for you in terms of your intro to improving skin quality with cosmetic procedures. So you have peels, you have lasers, you have hydrofacials, there's microneedling, there's microneedling with energy. There's a ton out there. In general, a light chemical peel or superficial chemical peel is a great starter. And again, this should be done with your board certified dermatologist or plastic surgeon. If you have tougher areas, things like melasma, really bad acne scarring, then you can consider a laser. Okay, remember that you go in aware of what your skin tone is. There is a scale of what we call a Fitzpatrick scale that lets us know, based on your skin color, how likely you are to tan versus burn. And that's very important when it comes to skin treatments, for instance. So darker skinned folks can have tougher reactions to just kind of what we consider standard laser and peels. Kind of for more information on that, please refer to my previous video about peels versus laser, which is best for melanated skin. And in fact, for melanated skin, I would actually say that microneedling is probably the very, very first step that you should take. Microneedling with energy are both great steps. What they do is they actually create little pores in the skin, and that demands from the skin to kind of regenerate in a very organized way, and that gives you typically great skin. Hydrofacial does not have to be done by a board certified physician, but should be done by a very well-reviewed and good licensed professional. These procedures can take anywhere from 30 minutes to an hour or even more. And who are they good for? They're good for people who just want to look a little bit more refreshed overall in terms of their skin tone. And if you've heard me talk about Korean beauty, then this is where I give a quick plug to Korean beauty, because I actually think that's a great place to start. It does not necessarily require a board-certified dermatologist. But you have me, who has given many a talk on K-beauty. And so please refer to all of those videos, because they will all be very informative to you about kind of where to start. In terms of chemical peels, lasers, hydrofacials, and microneedling, I give them all a 7.5. Okay, the entire category. Microneedling, I'd score a little higher, because that can be useful for all skin tones, all skin colors, without causing significant damage. So microneedling would be closer to like an 8, 9. Hydrofacials, I'd probably give like a 5. Chemical peels and lasers, probably be a 6. And I give them a 6 because they are not one size fits all, right? And if done by the wrong person on the wrong patient, they can be very traumatizing to the skin and can leave you worse than where you began. So I would say, if you are a darker skinned person, microneedling is going to be your best bet to start. If you're a person who's just a little bit shy but wants just to dip their toe in the water, then hydrofacial is a good place to start. If you are of any skin tone but really want to be a little bit more aggressive with skin rejuvenation, then definitely consider a peel or a laser, but definitely go to someone who's board certified, either dermatology or plastic surgery, and definitely go to someone who is familiar with working with people of your skin tone previously. So now we're going to go on to body, but have you tried any of these? Any of these work for you? All right, so for the body, what could be the first step? Well, there's so many options. One non-surgical way for body contouring is cryolipolysis or fat freezing. These are things like CoolSculpting and other brands like it, where you basically attach a console to your body where you have a pocket of stubborn fat, and you sit there and let the fat get frozen, and then hopefully after repeated sessions, it will be gone. It's best for areas, discrete pockets of stubborn fat. It is, again, not a weight loss procedure, but can be a great idea for stubborn pockets of fat. If you can pinch it, it's probably treatable with a CoolSculpting machine or similar. Again, what to expect: it's a console, sits on the body, you sit there, I think you sit there for at least an hour. You do have to do repeated sessions for it to be effective. I think the recommendation is for 3 to 6. And the reason why I say I think is because I'm going to rate it a 3. I'm not a fan of cryolipolysis. We have seen paradoxical hyperplasia, fatty hyperplasia from cryolipolysis. These are the kinds of things where it's not as reproducible a result as liposuction. And so as a first step, I would definitely say it's a 3. Maybe even lower than that, because it is quite expensive. You do have to do more than one session. So imagine paying something like $2,000 for one session, but then think about having to do 3 to 6 of those. With the money that you would have spent on those 3 to 6 sessions, you could have undergone lipo and been done, right? Lipo, of course, is surgery. So maybe you don't want to do that as a first step, but cryolipolysis versus lipo wins every time for me. It's reducible, the fat is actually gone. There's no risk of hyperplasia like there is with cryolipolysis. It's, far and away. Another one like this in this category that I also would give like a 1 or a 0 is Kybella. So Kybella is a series of injections that goes in that submental area, right, the double chin area. And the idea is that you get the injections, it's a chemical that actually breaks down the fat, and then you're left with no more double chin. For Kybella, you do need more than one session, and I do believe it's expensive. It can be painful because of the multiple discrete kind of injections that you need. So again, I give it a 0. I give Kybella a 0. And it's not just because it's expensive and it's painful. I also feel like it doesn't really work that well, because what happens is, with Kybella, you get this huge inflammatory reaction. So you get a ton of scarring from Kybella. And a lot of times what I've seen is that the scarring replaces the fat that was once there. So you still have a double chin, but now it's all scarred in, and not what you want. So I give it a 0. I wouldn't even try it. Definitely submental liposuction. See, this is where being a surgeon, it kind of makes me a little bit biased. But I think, real talk, Kybella ain't it, okay? Lastly is, for the body, skin tightening. If your concern is loose skin, right, and you want just a little bit of tightening, what do you think about skin tightening? Well, there are tons of things out there, but most of them rely on some type of energy that's produced underneath the skin. The effect needs to be underneath the skin to get the tightening. Radiofrequency treatments can be just superficial, or there can be a component that's internal that requires a small incision as well. These still can be done as kind of a clinic-based procedure. It does require multiple sessions to achieve, but these can be good for people who are looking to achieve some level of skin tightening. So what the radiofrequency does is it heats the deeper layers of the skin, and it causes collagen production, and it causes dermal contraction. The dermis is really that strength layer of the skin, and it's where we see that if that changes, we really do have what we call good quality skin. Radiofrequency is usually best for people who have, I would say, mild laxity of the skin. So you have a little bit of extra skin. It's not great for people who have pinchable excess, right? So if you have loose skin that you can actually like pinch because it hangs to that degree, then it's probably not going to get you the level of tightening that you want. But if you have a little bit of loose skin, it will probably be best. What to expect? Now, the range on radiofrequency machines is very broad. I personally have experience with Morpheus. Morpheus is, of course, the microneedling system that's infused with energy as well. And so you do see some good skin tightening there. That combined with an internal cannula that also produces radiofrequency can be really good for skin laxity. Typically, where I've seen it used and used well, those extra, I don't even know what you call them, but I definitely have them. They're just that little pocket of fat right where your arm meets your chest, right? Underarm fat, it can be used for that. Belly fat, you have a little bit of excess fat underneath your chin, your submental area, can be good for that. A little laxity in the thighs, it really can be good for almost all areas. If there is a cannula that's also inserted, there usually is a little bit more downtime. I would say a long weekend of downtime, but these typically you can do pretty well from without significant downtime. The actual session itself, depending on whether or not you're just using superficial radiofrequency or you're actually going deeper, that can vary anywhere from 30 minutes to 2 hours. It really just depends. And again, this is really, really good for people who don't have a ton of excess fat, but just have a little bit of excess skin where it just is a little loose. Again, if it's pinchable, if it hangs to the point where you can actually really pinch it very well, then probably not a good candidate. And you should think of more aggressive ways to address your loose skin. So for radiofrequency, I would give it a 7.5 again. It's one of those things where the results aren't as predictable as things like a tummy tuck, for instance, or a facelift. The result takes a while to see. The one thing that's good about radiofrequency is that you do see the result progress over time. That is to say that the energy continues to persist. And so the development of collagen is kind of this ongoing process. And so as the first year happens, you actually see progressive tightening. So by the end of the first year is when you really should judge the result. For that reason, it's a little bit better than other things that I've described as a good first step. But yeah, I'd say RF is still not as predictable. And so if there's any question about whether or not this will be effective, it may or may not be worth a try. It can be pricey. And again, when there's no internal cannula involved, meaning there's no incision that needs to be made, then you will need more than one session, and probably somewhere between 3 and 6 as well. So let's break that quickly down. So if your concern is lines on your face, Botox. If your concern is volume deflation, filler, but with caution. If your concern is your skin tone, definitely think chemical peels, lasers, hydrofacials, or microneedling. If you have stubborn pockets of fat, think cryolipolysis or Kybella if that area is submental, but again with a major grain of salt. And then lastly, if you have a little bit of skin laxity, then think radiofrequency. I would be remiss if I did not say this. Remember that none of this happens in a vacuum or in your home. This all needs to happen in a place with a board-certified professional, board-certified plastic surgeon or dermatologist who is trained to actually do these procedures. I just can't say that enough. Hopefully you found this helpful. Surgery is not always the first step, although sometimes it should be. But no, really, surgery is not always the first step. I understand that. And sometimes this world can just be a little bit scary in terms of what we do and where you should start. So if you found this video helpful, please like and subscribe. Even if you didn't find it helpful, just like it and subscribe, because I have a lot of things that I can share with you that I think at some point will resonate with you. As always, love you lots, and bye for now.